Welcome back, and today we're going to continue with the sports theme with another very common FAQ or frequently asked question. What are the most common sports-related foot and ankle injuries? Now, we talked about the ankle sprain and all the treatment modalities on another video, but the combination of ankle and foot usually start with the ankle sprain and then graduates to the midfoot and then the metatarsophalangeal joint area, and then a few tendons on the inside and outside of the foot, and then the classic bottom of the foot, the plantar fasciitis or even tearing of the plantar fascia. These are all very, very crippling for an athlete because, of course, we're dealing with torque, force from the body, and lever arm of the foot pushing off. Starting with the forefoot, the most common is the turf toe. This is a jerking up motion of the big toe joint. And if you look really close right here, you see two bones, one underneath over here and here in the big toe joint. And they're like kneecaps, kind of like a pulley system where it pulls the toe downwards and also you run through. So they're very important. They can get strained or even fractured. This involves quite a long conservative treatment and a walking boot, 6 to 8 weeks, or sometimes surgery. On the top of the big toe joint, this is just as common. You don't hear about it as much because it's walking and then catching the big toe joint, usually wrapping it under or not wearing shoes, if you will, and catching it and pulling it downwards. The tendon hooks right underneath the toenail on the top here. And again, they're very, very hard to heal, and they take 8 to 10 weeks, sometimes 12. Of course, the rest of the metatarsophalangeal joints can have injuries or dislocations, but the most dangerous in the foot is the mid-tarsal joint. And all these small bones and where these long metatarsals meet, they have an extensive ligament attachment dorsally and plantarly that's on top and bottom. And if that's strained, of course, you're going to try and let that heal for 3 to 6 weeks, especially with some arch support or functional orthotics. Sometimes we make the athletes a custom orthotics, and they'll stay in those very rigid pair until this heals. The very, very bad strains don't heal right, and it's a very serious sports injury, and of course that can involve surgery. The inside is the posterior tibial insertion. That's a tendon that inserts in this bone on the outside on this bump here, the fifth metatarsal base. Well, that's the peroneus brevis. That's another serious one. Those, including the plantar fascia, are easy to treat if it's a stage 1 or stage 2, but again, if it's a stage 3, that most likely will involve surgery. Again, hopefully that was helpful for all you athletes out there. If you would like to see more of these videos or even surgery videos, you can log on to my YouTube channel, Dr. Robert J. Moore III, or Ask Dr. Moore channel, which has much more of these FAQs or frequently asked questions. If you don't like what you see, you can ask a question in the comments section and I'll get to it as soon as I can. Thanks for tuning in. Again, stay healthy and one step ahead.